eloquently speaking. Welcome back to another episode of Legal Talk, where law meets justice and advocacy becomes action. I'm your host, Dr. Vickie Simon, and in our last episode, we unpacked the systematic failures that keep equitable healthcare out of the reach of Black, Brown, and underserved communities. But today, in episode B, we shift from injustice to impact, because while the system may not have built it for us, we are more than capable of reshaping it through legal action, community power, and bold and informed leadership. We've already seen how silence in state commissions and cuts to Medicaid has cost lives. But let's talk about a recent local example. In 2023, Atlanta Medical Center, one of the few remaining hospitals serving Black and low-income families, closed its doors. There were no emergency protections, no pause on the closure, and no intervention from state leadership. The result? Longer emergency wait times, pregnant mothers rerouted across counties, and healthcare deserts that expanded. This wasn't just a hospital closure. It was a policy failure with life or death consequences. And this pattern, it isn't new. Because in 1910, the Flexner Report restricted American medical education. While it raised its standards, it also led to the closure of 5 out of 7 Black medical schools in the U.S. that drastically reduced the number of Black physicians for generations. That decision wasn't just curriculum. It was a legal and systematic choice that left Black communities without adequate or culturally competent care. And we are still feeling that ripple effect of that report just today. So what can we do when institutions fail us? We turn to community power across the country. We're seeing bold models of localized healing. Community birth centers led by Black midwives. Mobile health clinics in rural and inner city neighborhoods. Legal aid groups advocating for patients' rights and medical discrimination cases. Medicaid expansion. Coalitions organizing at the local level. These aren't just services. They're revolutionary tools of justice and rooted in accessibility, trust, and cultural awareness. Now, if we want to see a shift, we must engage with the legal process. And that means demanding accountability from public health boards that haven't met, calling out unconstitutional Medicaid cuts, tracking hospital closures, and introducing protective legislation, and pushing for passage of the Black Maternal Health Omnibus Act, which to this day remains stalled in Congress. We need to be in courtrooms. We need to be in council chambers. And we need to be in comment sections, speaking truth to policy. In the absence of systematic repair, local innovation have become our lifeline. Black-led maternal health coalitions are rewriting local hospital policies. Pro bono legal clinics holding healthcare institutions accountable for bias and malpractice. Mobile health and legal units bringing services directly into marginalized neighborhoods, and city ordinances passed to prevent abrupt hospital closures in under-resourced areas. These aren't patchwork solutions. They are blueprints for what equity can look like when we fuse legal literacy, grassroots actions, and city pressure. We don't just need voices. We need strategists. We need organizers. We need legal disruptors. And here's how you step into that. Disrupt. Use the FOIA, the Freedom of Information Act. It requests us to hold health boards accountable and make data public. Build. We have to build together. Partner with advocacy groups to draft city level protections for community hospitals, mobile clinics, and maternal health centers. And protect. Engage with legal aid orgs that fight insurance denials, dismissal of pain and medical racism. Even volunteering admin support expands our reach. This isn't about reacting. It's about reconstructing the system to finally reflect the communities it claims it serves. This is bigger than access. It's about designing an ethical healthcare future with law and leadership that are rooted in justice. We need a new generation of policy writers, public health attorneys, data analysts, ethical funders, and watchdogs. People who won't just march, but people who will amend, draft, sue, propose, and defend. Because if we keep showing up only to plead for justice, we will forever stay on the outside of change. We must be the system we're asking for. So let this episode not be a conclusion, but a call to action. Form a board, join a commission, propose legislation, write a public comment, reimagine the table, and build a seat for someone else. This has been episode 2B of Legal Talk. I am Dr. Vickie Simon. Be informed, be strategic, and be unshakable. And I'll see you at the front lines of reform. Until next time, stay informed, stay ethical, and keep serving your community. Please like, share, and subscribe to my channel. We love you here at Legal Talk. Thank you.